When we look at the diaphragm, we need to think about what the diaphragm is actually functioning to do. When you inspire, what happens, the diaphragm contracts and pushes down. So it increases the vertical diameter of the thorax. And in doing so, what it does is change the intra-abdominal and intrathoracic pressures, allowing for the proper inspiration and exhalation of air. The diaphragm itself is this sheet of muscle that ends up pushing into the thoracic cavity. Okay? To orient yourself, we have the head would be this way, and the legs would be that way. What you're looking at here are the aorta. To give you an idea, this is a kidney. Okay? You have the other kidney on this side. And this here is your inferior vena cava. So, now that we have our bearing, we get an idea for this being the diaphragm. Okay? And what happens is the diaphragm pushes into the thoracic cavity. The diaphragm pushes all the way up to the fourth intercostal space on the right side, and on the left side to the level of the fifth rib. Therefore, it pushes a little bit higher up or more superiorly on the right side. The reasoning for that is because of the organ that is found directly below it on the right side, which would be found right here, and that's the liver. The diaphragm attaches to several places. It attaches to the back of the xiphoid process, which would be in this area here. Then it attaches to the inner inferior surfaces of the lower 6 ribs, which we sometimes refer to as the costal margin. As that comes around, it also attaches to the lateral arcuate ligament and the medial arcuate ligament, and also to the median arcuate ligament, which I'll describe in a second. And it also attaches to the lumbar vertebrae as the left and right crura. Okay? The left crura is what goes onto the sides of bodies L1 and L2, and the right crura goes onto the sides of the lumbar vertebrae L1, 2, and 3. So in this instance, what you can say is that on the right side, the diaphragm pushes a little bit higher, so more superiorly on the right side, and it also extends most inferiorly on the right side because that third crust reaches the level of the third lumbar vertebrae. All of those attachment points then end up inserting into what is called the common tendon, or the central tendon. The central tendon has the heart sit right on it. And the fibers of the pericardial sac, of which we have some remaining here, are continuous with the fibers of the central tendon. The nerve responsible for feeding or bringing motor fibers to the diaphragm itself is the phrenic nerve, coming from C3, 4, and 5. And you can remember that from either C3, 4, and 5 keeps the diaphragm alive, or phrenic is our friend. Okay? Some other items that we need to address about the diaphragm are the 3 items that pierce through its muscular wall. We have a mnemonic to remember this, and that mnemonic is IKEA, where I stands for inferior vena cava, K stands for nothing, E stands for esophagus, and A stands for aorta. What's nice about the IKEA mnemonic is that it gives you the order of the items that pierce through the diaphragm from anterior to posterior, and also from superior to inferior. So the first one, the I, is the inferior vena cava. The inferior vena cava pierces through the diaphragm at T8. Coming through right here. The esophagus pierces the diaphragm at T10, where it will go, my finger will be the esophagus, goes to the left, and almost immediately comes in contact with the stomach as the cardiac orifice. The third vessel is the aorta, and this is the aorta right here, ends up piercing through the diaphragm at the level of T12, where it goes through and has the median arcuate ligament lined on its anterior surface. And this is the aorta as it continues down before it branches into its common iliac arteries. Now I'm going to reflect the kidney back here so we can look at the side and examine the posterior abdominal muscles and try to clarify for you where the medial and lateral arcuate ligaments are. So the arcuate ligament is essentially one continuation, but we just break it into the lateral aspect and the medial aspect, and then actually right over top of the aorta, right in the midline, we call that the median arcuate ligament. So we have the medial arcuate ligament here. You see this, the thickening of the fascia, and then coming lateral, you continue to see this fascia here. This is the lateral arcuate ligament. So when we talk about the muscles that make up the posterior abdominal wall, we talk about the psoas major, and this is the psoas major right here. The psoas major will originate from the sides of vertebral bodies L1 through L5, the medial arcuate ligament, and will go down and insert into the femur. To its outside, these fibers here that are running superiorly and inferiorly, so vertically, I guess, those are the fibers of quadratus lumborum. Quadratus lumborum originates from the transverse processes of L1 through L5, the lower border of the 12th rib, the lateral arcuate ligament, and inserts into the iliac crest. And I might as well introduce another muscle which is found a little bit further down, which is you can see it nicer on this side actually, the iliacus. And the iliacus originates from the anterior border of the iliac crest and inserts into the femur. And iliacus, the muscle fibers of iliacus will fuse with the muscle fibers of the psoas, but right before it enters into the head of the femur, and that muscle becomes known as iliopsoas. Turning our attention back more superiorly, I wanted to bring up a couple other items that are more for your theory and not so much what you're going to be able to identify in lab. First, for the phrenic nerve, as I was saying, that it originates at C3, 4, and 5, and it comes down and provides motor innervation to the diaphragm itself. But it also provides sensory information from the mediastinal parietal pleura, the diaphragmatic parietal pleura, and the fibrous pericardium. So in addition to the motor fibers that it provides to the diaphragm, it provides sensory to those three items. As I said, the mediastinal parietal pleura, the diaphragmatic parietal pleura, and part of the fibrous pericardium, which are some of the fibers are here and here. Okay? Also, when we talked about the esophagus piercing through the diaphragm at T10, keep in mind that it's going to be piercing the diaphragm with the vagus nerve. The left vagus traveling on its anterior surface, and the right vagus nerve traveling on its posterior surface. Another item that's going to pierce through the diaphragm is the thoracic duct. And the thoracic duct does so at the level of T12 with the aorta. There's a dilated sac inferior to the opening on the aorta at the area of L1 that is called cisterna chyli. And it collects lymph from all of the abdominal and pelvic regions. When it does so, it sends off the thoracic duct, which will pierce through the diaphragm at T12 with the aorta and travel superiorly along the vertebral column before it enters back into the venous system at the junction of the left subclavian and left internal jugular veins.